girl Bree Nicole, and I'm back with another video. And in this video I will be talking about my last and final semester of my LPN program, and this was the third semester. So in this semester we actually had 2 nursing courses. The first semester was only 1 course, the second semester was only 1 course, and then this final semester was 2 courses. It was nursing 114 and nursing 115. So 114 was nursing concepts 2, and then nursing 15 was evidence-based practice of nursing concepts. So the approximate cost for this final semester for tuition was $1,600 for both of these courses combined, not including all your other fees like cap and gown, diploma fee, graduation, NCLEX, all of that stuff if you're participating, and your nursing pin and all that extra stuff. So this semester started in the spring of 2018, and I'm just gonna go over, like I did in my last video, of everything that we learned in this semester. So class days was 1 day a week. They were from 8:30 to 1:30 p.m. I think on Mondays, and then we only had one like skills lab day because we had just came back from Christmas break, so we were out for like a month. So the first week of school they had a skills labs day where we could practice any skill we didn't feel comfortable coming back doing. So it was anything, whether it was Foley's, IVs, medication administration. They had everything set up, and they said this is going to be a skills day. We're just going to rotate. You're going to spend like 30 minutes at each little session, and then we're going to rotate. So we got into groups and we did that for a full day, and so we can get back comfortable doing skills before starting clinicals. So I felt like that really helped us being out for Christmas break. So like I said, class was 1 day a week. Clinicals were anything from 1 to 3 days, depending on what clinical group you landed in and how the schedule fell. First, I'm going to go over the class concepts that we talked about, like I did in my last video. And like I said previously, my instructors will upload a calendar for us to print off and put in our binders. The calendar included class days, lab day, test days, and like simulations and stuff that were important that we had to be on campus for. They told us to include our clinical days just by writing it in ourselves so we could have it all in one spot. So that's what I would do. I would print off this calendar and then write down my whole clinical schedule and put it in the front of my binder. We had 5 regular tests this semester. It was a lot in this final semester. It was a lot. We had 5 regular tests, and we had a comprehensive HESI of this nursing 114 stuff, and then in the second class was when we had our full LPN program comprehensive test. So I'm going to talk about that separately. Right now I'm just talking about nursing 114, which was nursing concepts 2. So test 1 was the reproductive concept. It was antepartum, intrapartum, postpartum, and newborn. So it was everything OB. So from the time a woman conceived up until she had her newborn, this is what this whole concept was. It was a lot. We went through the whole pregnancy and everything. Like I said, from the time she got pregnant up until like newborn stuff was on this first test. Test 2 was growth and development. It was ADHD, autism, cerebral palsy, Down syndrome, failure to thrive, and eating disorders. So it was mostly geared towards pediatric disorders. Also, they included some mental health stuff on this second test. Depressive disorders, anxiety disorders, personality disorders, bipolar, schizophrenia, addictive behaviors, and abuse and neglect. So all of these disorders were on test 2. Test 3 was sensory. So it included vision disorders like cataract, glaucoma, macular degeneration, detached retina, and just eye injuries, and hearing and verbal alterations. Also included on test 3 was sexuality. So it was erectile dysfunction, family planning, such as like contraception and being infertile, so infertility, menopause, menstrual dysfunctions, and sexually transmitted diseases were on this third test. And I know it was like kind of all over the place, but they were trying to put concepts together that kind of like correlated. So even though vision and sexuality really didn't correlate, but they tried. They just had to fit everything in. Test 4 was elimination and cell regulation, and also immunity and inflammation. So test 4 had a lot. It included acute renal injury, nephritis, acute glomerulonephritis, chronic renal failure, cancers including skin, colorectal, breast, cervical, prostate, lung, leukemia, and testicular, HIV and AIDS, hypersensitivity reactions, lupus, arthritis, and that was everything on test 4. So that I remember being a big test, and I think I actually made like a 70 on that test. It was a lot of stuff on that test. It was really hard. And our final regular test was perfusion, which was coronary artery disease, dysrhythmias such as asystole, AFib, aflutter, VTach, VFib, bradycardia, tachycardia, anemias, basic heart failure, pulmonary emboli, SVA, cerebral vascular accidents, and hemophilia. Also emergency. So it was like some basic things people would come into the emergency room with. So it was burns, poisonings, shock, water injuries such as like near drownings, environmental emergencies, anaphylactic reactions, and increased intracranial pressure. So that was all on test 5, and that was everything we learned in the final semester of our nursing program. And then we had a final HESI on all of that stuff, and it was horrible. I think I did horrible on that test. And by horrible, I mean, I think I made like the bare minimum that I needed to pass the class. So it was really hard, and they told us like past students even said that that semester was hard. So for my class test, I used, of course, my Saunders book. Like I said, it had all that stuff in the Saunders book. I bought, oh yeah, I already had Med-Surg Success from second semester, so I continued to use that. I bought maternity, and I think it was like maternity success, and I bought mental health success, and then I utilized your best grade for my HESI final, and then my comprehensive HESI. Also, the teachers, they gave us like handouts, PowerPoints, all of that for class review as well. So I just utilized everything that I could for nursing school. And we also had a question bank that came with like our tuition called Evolve. I forgot to mention that in my second semester video and my first semester video, but I'm gonna put it down in the description box in both videos. So we had a question bank called Evolve by Elsevier. Well, we were able to utilize that for like case studies and extra question practices. We also had to do 2 simulations this semester. One was an EKG simulation course, just looking at like rhythm strips, and then the final one was we were put into groups, and there was like a mannequin that was like down, and we had to do like chest compressions and do an assessment. It was just like a lot. They had it written down. I can't remember what all exactly we had to do, but it was like a final simulation for us. And as far as clinicals, we had Med-Surg clinicals, OB, emergency room, psych clinicals. We had an elementary screening clinical again, and then our preceptorship, which was included in the nursing 115 class. So Med-Surg was the same as my previous video. We went to the hospital, did skills and everything. The OB clinicals, we were split up because, you know, OB was all different. So I got to do clinicals in antepartum, where moms were coming in pregnant and like sick, having contractions. So I got to see that part. We did labor and delivery. So I did get to see someone deliver a baby. I got to see a C-section as well. We were in the nursery, so that was like kind of the newborn part, I guess. We did vitals on babies, bathed babies, got to see babies being circumcised. And then we did like the mother baby care, which was like massaging the fundus and learning about the bleeding and what to do to help moms after giving birth. So OB clinicals were really fun, but it just wasn't my passion. In the ER, we did inserted IVs, pretty much with skills, just people coming into the ER sick, and we were doing skills like not COVID swabs, flu swabs, strep swabs, inserting Foleys, drawing labs, inserting IVs, looking at different tests and everything when people were coming in with like arrhythmias and stuff like that. So we got to see a lot. And I want to say we were in a code one time I went to the ER, so we got to do like chest compressions on a person. Psych clinicals were crazy. We just pretty much got to talk to the people. We played games with them. Some of them talked about why they were there because they knew we were nursing students. We couldn't bring anything with us to psych clinicals. We had to pack our lunch, and they said like a brown paper bag. We couldn't bring in anything that they could get a hold of that could cause them to like harm themselves. We couldn't like chart on them. No pens, no pencils, no stethoscopes, no pens. We had to have our keys and phones locked up in their nurses station, and our lunches. So we just pretty much went out there with nothing. So we just pretty much talked to them about why they were there. Some of them were standoffish. They were like, get away from me. And others did talk to us. We played cards, colored, board games. It was pretty much like a communication type of clinical where we learned how to communicate with people with the different like mental health disorders, if that made sense. So it was pretty much like an easy day, but it was a very long day because the day kind of dragged on since we really weren't able to do anything. And we also did have to do like 8-hour clinicals for psych. We also had another elementary screening, so it was like before where we just checked for scoliosis. So that was a really easy day, and we got to leave early. And that was everything that we did in our 114 class. Now the 115 class was separate. It was with a different instructor, and that class pretty much got us ready for the work field. Class for them was one day, and it was only an hour long. So we only met an hour for this class. It was from 2 to 3 once a week. We didn't have any clinicals for this class. It was like our professional class getting us ready to become LPNs. So this is the class that was over our preceptorship. So this class was called Evidence-Based Clinical Reasoning. This is the class that we took our comprehensive HESI in. So this is the class that we took a comprehensive 150 question HESI that was from start to finish, like over our whole program. It was everything we learned from fundamentals up until this point. So when we first started the semester, we took a mock HESI to basically show us like, hey, this is what your final HESI exam is going to be like. So we took that mock HESI the first month when we went back in January, and we were scored on it so we could see like the areas where we were low. And like I said, this was like the more professional type class. So we talked about job interviews, the work environment, and we did have 3 like unit exams in this class. The first test included healthcare systems, hospital system. The second unit was legal issues in nursing, accountability and responsibility, professionalism, and then we did like a licensure type of thing. They went over how to apply for your license. And unit 3 was delegation, and then we had like a resume assignment where we had to create a resume. And then we did the nursing licensure and certification. So they just pretty much went over like, this is how you apply for your nursing license. This is how you go to Pearson VUE to take your NCLEX. So like I said, it was just like the professional side of things. They talked about interview tips, questions, how to like do interviews, that type of thing. And then like I said, we had to create a resume to turn in. And then this was the class that was also over our preceptorship. So they gave us our preceptorship paperwork, and we got to schedule our preceptorship on our own, like the actual days, because we had to base it around our clinical schedule. So we had to do 48 hours of preceptorship. You could either do 8-hour shifts or 10-hour or 12-hour shifts. It just had to equal up to 48 hours. So you could either choose to do your preceptorship at with a school nurse, a nursing home, long-term care facility, a rehab facility, a doctor's office, or an urgent care. And I think that was it. We weren't allowed to do any other places. We weren't allowed to go to hospitals, even though some hospitals do hire LPNs. We just weren't allowed there. So they made us fill out this form, and we had to put like our first choice where we would want to go, and our second choice, and then the city that we lived in, because they would try to place you somewhere in a city that you lived. Unless it was like a lot of y'all in the same city, then somebody maybe had to go like out of town. And then you have to put your preferred shift, like day shift or night shift. So I was being lazy. I knew I was probably gonna work at a nursing home after I graduated, but I put school nursing because I did have my son. So I just did 7 to 3 with a school nurse. I got what I picked. I was the only person in my town where I lived, because I lived like 35 minutes from my school. So I was with a school nurse in my county, and I did 6 8-hour shifts with her. And I once I got my assignment and they contacted the school, I met with the nurse and I looked at her schedule, because of course she had some days where she had to go on like field trips, or she was just gonna be off. So I just wrote down the days I was able to come based around my class days and clinical days. You could not miss class or clinical for your preceptorship, and they will tell you that once you're getting ready for it. So I did that. I completed it. It was fun. I got to administer like some flu shots to some kids, do some hearing tests, administer medications to some kids. There were like the kids in the special need classes that had like the button tubes and peg tubes. We got to administer their bolus feedings to them. Once I completed that, you have to turn in this whole packet that your preceptor has to fill out, saying how you did you show up every day. And after that, we had our pinning ceremony, and then we had our graduation, and then I was just officially done with the program. And then I applied for my well, the school sent everything they needed to send to the Board of Nursing. I took NCLEX a month after graduating. I did get my temporary license because I was broke after all that stuff. So I got my temporary license literally like 2 weeks after finishing school. And then I started working immediately. And I want to say like from the time I started working, I took NCLEX like a month to like a month and a half later. And I passed on my first try. And then I worked as an LPN for up to 3 years until I decided to go to school for my RN. And the rest is history. So that was pretty much my whole nursing school program, broken down into 3 different semesters. So I hope that helps someone. I know a lot of people had a lot of questions about my program. If I missed anything, comment down below and I'll be sure to get back with you. Don't forget to like, comment, and subscribe, and let me know what other videos y'all would like to see, and I'll be sure to get them out to you guys. And I will see y'all in my next video. Bye guys.